The intention of this video is to show how to guide a patient through the use of a mirror box for someone with unilateral hand pain. This technique can be used for either arms or legs with a little creativity on how to use the mirror. It's important that the patient's pain is unilateral since we'll be using their normally desensitized hand and tricking their brain into thinking that that sensation is what they're feeling on their painful hand. This works through the use of mirror neurons. These neurons, these are neurons that respond to sensation of the normal hand and mirror that sensation onto the painful hand. This will make more sense by seeing it in action through the mirror box, so let's get started. Here I'm going to give you the verbal cues given by the physical therapist to the patient. This is your mirror box. It has a hole on one end that you can place your impaired hand, so the hand that is having is painful, inside the box, while placing your hand that is less sensitized and in less pain on the outside of the box. You will be asking the patient to be looking into the mirror and treating the hand that they are seeing in the mirror as their impaired hand. So in this case, my left hand is hurting, it's inside the box. My right hand is not, it's outside. I am looking in the mirror and trying to get myself to believe that what I am indeed seeing is my the reflection is actually my left hand. So I'm going to go through the cues given for how to provide pain relief to the painful hand. These cues go through, they start with techniques that you would use for somebody who is very, very sensitive to pain. If they're in a lot of pain, you'll start early on with some of the easier cues. If you're progressing and any of these cues are starting to hurt too much, you can always take a step back. You can go back to other techniques and to help them work through their pain. And as they get a little more comfortable with their pain, they can go further along in this treatment. So to start, we will ask them to keep their hand inside the box still and resting in a comfortable position, and to keep their hand outside the box still and resting in a comfortable position, and just observe the reflection. Next, with the hand inside the box still resting, we want to rotate the hand outside the box. Now, while they're going through these different techniques, you want to ask them what they're feeling, how their pain is. Keep that dialogue going so that you can get a sense of whether or not you are moving through at the right pace, doing the right movements, or whether you should be stepping back and going easier on your patient. Next, you keep your hand inside the box still resting, and you ask them to oppose each finger separately outside the box. Next, with the hand inside the box, keep the hand resting with a slight bend at the fingers. And outside the box, make a fist, then slowly relax. Repeat. Next, with the hand inside the box, keep your hand bend with the wrist up and down within the limits of pain. With the hand on the outside the box, bend the wrist up and down through full range of motion. Next, with the hand inside the box, oppose the fingers and gently touch together. With the hand outside the box, oppose the fingers and press with some force together. Next, with the hand inside the box, make a fist, pushing into some discomfort. Then you're going to repeat with the hand outside the box. At the outside the box, make sure make a fist and squeeze in repetitions. And then with the hand inside the box, we're going to rotate the hand and wrist fully, and copy this in the hand outside the box to the full range of movement. At this point, you would start having the patient manipulate objects within the box, the cue, and outside the box. So the cue could be move both hands fully and add in some tasks like squeezing a ball or writing, and you would copy that on the outside of the box. So I could be squeezing a ball or an object with both hands, manipulating them in different ways. And you could also then progress that to be using some harmful, what they might consider harmful objects like a knife, something that could be construed as dangerous, and get them accustomed to the use of their hands within that context as well. So that is the use of the mirror box. It can be very helpful in helping to desensitize a patient who is very sensitized to pain. And I hope you enjoyed the video, and thank you for watching.